Welcome, students. This presentation is a topic from the subfield of economics and an applied field. It examines the relationship between economics and healthcare. So, in this presentation, I shall look at how healthcare is seen from an economic perspective. Economics is a social science, is a part of the study of society. Now, if I have to define economics, I would say that economics is a study of the creation of wealth. It is a study about how wealth is distributed and how wealth is consumed. But is economics only the study of wealth? What is the purpose of wealth? The purpose of wealth is to increase the welfare of people. So that is the second definition of economics. If we can improve the welfare of people, why can't we improve the welfare of all people? Now, that cannot be done because we have scarcity of resources. It means that the resources that we have at our disposal, either at the individual level or at the national level, is limited. We do not have unlimited resources. But if you look at the wants that we have unlimited wants. So we need to make a choice. How can we adjust this unlimited wants to this limited resources? For example, what has happened in the medical field now? We have seen that during this period of COVID, the hospitals had to take care of COVID patients. So, what happened to the treatment of non COVID illness? That had to take a back seat. So, we had to make a choice between treating COVID versus non COVID patient. That is a choice because we have limited resources. If we had unlimited resources, there was no problem. We could have done both. But since we have limited resources, we could not take care of both. The question that comes up is, why should a nation want to be healthy? Why do people want to be healthy? Think of the answers for that. Now, the question is, how is health produced? How is health distributed? How is health consumed or demanded? What factors influence the demand for health and healthcare? What are the factors that determine that? What constitutes the supply of healthcare? Can we reach an equilibrium between the demand for health and the supply for health? Currently, with this COVID situation, are we able to match the demand for healthcare to that of the supply of healthcare? Certainly, we are not able to match. Just look at the number of deaths that occurred due to the non availability of oxygen cylinders at the right time. So, what has happened? We could not match the demand for oxygen care by the supply of oxygen care, and this led to death. So, in economics, we say that the demand must be equal to supply, and there is therefore a price which is set, and at that price, the market will clear, or all the goods produced will be sold. All the consumers who want the good will be getting the unit. Now, what happened when we saw that the demand for oxygen outstripped the supply of oxygen? We saw that oxygen cylinders started getting sold in black market. That is how those who had more money could buy those oxygen cylinders, and those who did not have the money could not buy it and were kept to die. So these kind of issues, a student of medicine will look at it from a medical perspective, that once medicine, the oxygen doesn't come, these are the medical implications of lack of oxygen and so forth. Now, an economic student will look at it, when the supply of oxygen does not meet the demand for oxygen, what can be the fallout in terms of black marketing, in terms of market failure, in terms of investments and so on. How can the economy equip itself for the need of healthcare in society? So, what are the economic reasons behind this example of vaccinations, or behind the reasoning of non-essential treatment of non-COVID treatment being kept back, or the non-availability of hospital beds. All these are issues that a student of economics will be able to analyze by using the theories and principles in economics. For those of you who are watching the video on a subject like this from the field of medicine, I would suggest that a good understanding of microeconomics makes it much easier for you to understand the topics on health economics. Therefore, I am not going to do the economics or microeconomics here, because you will find that I have a series of videos prepared, and it's all uploaded, so you can watch those videos on every topic in microeconomics, which has been done in a very sequential manner, and they have been numbered. So when these new words are introduced to you, like demand or supply or equilibrium or market mechanism, you will find a video that is already presented to you. Some of those links I will give it in the description box, but the others you can search. If you have some words to search, you will find almost all the topics in microeconomics on my channel. Now let's look at another set of questions. What do health economists do? So what we do is we apply the concepts of economics to the health sector, and as I just explained to you, examine the various issues like why is there shortage of vaccine. Now, the bioscience student would tell us that the vaccine shortage happens because of, producing the vaccine or whatever that medical part of it, which is not in the domain knowledge of an economist. But as an economist, we can find the reasons behind the shortage of vaccine. Was that a policy which was made correctly? Was the production sector ready for the production of vaccination? Was the supply of vaccination to the different parts of the country done in a way that it could reach the people? So these are issues that a student of economics will look into. We are not looking into the bio sciences of the production of medicine. So we want to see how are these health institutions working, and what is the health delivery system. We would now say that the health delivery system has been inefficient because we have had so many deaths and so many people who have suffered from this COVID pandemic. So what has happened that these number of people had to die? So when we try to explain these kind of non-availability of hospital beds, and this non-availability led to black marketing of the hospital beds. It led to the ambulance person charging a hefty amount to ferry people, sick people from home to hospitals, or it could be about the oxygen cylinders that were sold at fancy rates as per the supplier of this oxygen. All these are, you also saw the black marketing and hoarding of medicines that were used in COVID treatment. All these are they are all explainable from the economic perspective, and that is what an economist will look at. Why has it failed? What factors have led to this failure? So an economist is interested in the production of a number of health services at different levels, be it at the hospital level, be it the number of doctors that are required to man the hospitals, or the requirement of the nurses that need to be trained to handle the COVID patients, or any of these examples. In all of that, you will find that an economist's interest is to see whether the demand for the hospital services, the demand for the doctors to service the sick people, are there enough number of people to take care of these kind of things? That is the activity that an economist will be able to analyze and give answers to that by looking at the data that is made available to them. So the other important thing that an economist does is also what is the value of health. You have seen that when health insurance is made, then the person's health is asked. What is the value of a person's health? How much is that person capable of working after this age? Say a person who is young, what is the amount of premium that needs to be paid? What is the premium when persons grow older? What happens to the premium that is paid? Why is it that the premium increases for people as they get older? So these kind of issues that are related to valuing health itself is an important function of students of economics. We also need to understand what are those factors that influence healthcare. Is it only healthcare that influences health, or are there other factors that can influence health? For example, we know that medical doctors, hospitals, and all of that does influence health of people. But are there other activities also that can affect health? Yes, there are. For example, food, nutrition, and nutritious food, clean water, clean drinking water, or you have sanitation, or you have housing. Now, these are factors, they don't fall under the category of medical care. They fall under the category of policy making, and these are development issues. So, an economist will also examine these kind of non medical issues which can promote health to people. Pollution levels, for example, what is the need to reduce pollution? Because pollution impairs the health of persons. So that becomes a journey of an economist to understand the effect of pollution on people's health. Then the question would be, how can this pollution be controlled, and what kind of allotment of resources have to go in for controlling pollution, or if it is water pollution, or if it is worms in children, then how to deworm children, what is the cost of deworming children, how are pregnant mothers and lactating mothers to be taken care of in terms of reducing the maternal mortality or infant mortality. What is needed to do all these kind of activities? These are issues that are taken up by health economists. They understand these issues as resource issues. They don't look at them as biomedical issues. They look at them as resource issues, and to understand these resource issues, they find ways of allotting resources to different sectors, and say how can they provide healthcare to different sectors, and what kind. Now, all kind of treatment will not be given at all times. So how can they provide what are the alternative ways of production of health? Can food itself can take care of nutritional problems, and therefore many of the diseases that are related to nutrition can be taken care of by health food? What happens to the problem of obesity, for example, or diabetes, for example? Can these be controlled by economic policies of like taxing a certain kind of food, or giving subsidies for the production of certain kind of food? All these fall within the realm of economics. So we look at the efficient use of resources that are available. In fact, it means that we should not be wasting any medical resource that are available. So how do we look for efficient use of medical resources? It would mean, for example, now we have been hearing about the shortage of vaccine on one hand, and we have also been listening to this problem of wastage of vaccine. Now, wastage of vaccine means there is a scarce amount, a small amount of vaccine available, and a large number of people waiting for that vaccination. If we do not use available vaccines efficiently, we are wasting. So we cannot afford to waste. That is where an economist would come in, and an economist would look at how to plan that, how to budget it, how to monitor it, and then how to evaluate a policy that has been made about the vaccination that has been distributable to people. So all these issues of actually making the medical sector work for people in society from an economic perspective falls in the domain of health economics. There is also another subject called macroeconomics. What I have explained to you right now is microeconomics, where we were looking at the behavior of individual firms, we were looking at the behavior of individual hospitals and doctors and so on. But we also have a larger issue in the economics which we study. We call it as macroeconomics. In macroeconomic studies, it also called as general equilibrium approach, what we do is we find how the sectors are interdependent, how the various sectors providing health and healthcare are interdependent, how the healthcare is a factor that determines the nation's output, how does it affects the nation's employment, how does it affects the nation's investment, how does it affect the nation's export. Now all of these activities are not in the field of medicine, it is definitely in the area of economics of health, where we will analyze these kind of problems from an economic perspective. So it examines why is it that different countries spend different amounts of money on public health. What are the during a crisis as the one that we are seeing now, what is the government spending on health? What is the problem if government wants to spend more on health? Why is it not able to spend more on health? If the economy is doing well, can it spend more on health? What is the relationship between the economic decisions taken on healthcare and its spread over the short term and over the long term. Now, for a student of medicine, it is ideal to have stop people from interacting with each other at close distances, because we have learned that the virus travels from one person to the other and gets transmitting the disease. So we went in for a lockdown. Now, the lockdown is not the function of the student of medicine to understand, but for a student of economics, that lockdown is a major subject of analysis. What has happened because of this lockdown? The number of diseases have come down, but what has happened to the livelihood of people? What has happened to employment? What has happened to consumption? What has happened to production? What has happened to the resource utilization that the country has? So when we want to bring about one activity, then another activity is being challenged. Therefore, we need to understand what was the benefit of having taken care of a lockdown this way. Was there a better way in which we could have locked people into different spaces so that we could have minimized the way people interacted with each other? So these are issues of economics and its planning. It's a subject matter of policy making. So an economist will look at the short-term fiscal benefits, the allocation or reallocation of resources to the developmental activities that need to be carried out in terms of healthcare. So we can also see how the health, when the nation is not healthy, how does it affect the labor supply? Now we saw the number of people moving away from the cities into their hometowns. So what happened there? So how did this labor get affected because of a disease? Or you can see the productivity of people when people have fallen ill with this disease. Has it affected their productivity once they have gone back to their work? Or what has happened to the issue of corporate capital formation because of this disease? What has happened to the children who should have learned some things at that different age? What has happened to students who have supposed to be going to college and learn? Now, what has happened to various forms of capital formation? What has happened to the skill development of people? So all these are issues that an economist will try and engage and find answers, or provide solution which policymakers will use them in their policy making. Also, we need to see how do we understand environment, and environment, the Millennium Development Goal, how does it fit into this large story of health? Are we going to be able to provide health to all to meet the Millennium Development Goals? Let me take you through a journey of a patient which is very familiar to all of us. But then I just thought that if I give this journey, I can also use the various concepts and various ideas that can provide an insight into the idea of health economics. So, what happens when a person falls ill or takes ill? The first reaction would be that he or she is restrained from carrying on certain activities that he or she normally does. Then the next question is, if he or she wants to get out of that state of physical restriction or mental restriction, what is the best way out? Possibly they would look for some kind of an information from families and friends, or information through advertisement, or today, since information is available on the net, one would go through reading about one's illness on the net. and then try to gather some information. Then a person may take, so you are gathering information. Now you have to spend time and effort in gathering information. After that, you may have come to the conclusion, you have made a decision, a choice, that you may want to go to a drugstore and over the counter buy a medicine that can elevate the pain that a person is going through. Now over the counter medication is harmful, we know that, but then why does a person opt for this method of self treatment, where he or she goes to a pharmacist and gets the medicine to cure herself? So these are issues, decisions on which individuals have taken. So here your economics is, there is some element involved which is preventing them to go to the hospital or to a doctor. So these choices can be influenced by whoever are able to influence this person, or by the information that he or she has taken. Now assuming that the patient could not get well from this, now the patient may have to visit a doctor. We have seen that in the case of COVID as well, that why people waited for so many days before they went to the doctor, until they felt really sick. Why did they not go to the doctor? So there are issues that, it could be financial issues, it could be social issues. I'm looking only at the financial issues that are involved with these kind of decisions that individuals make. Now, visiting a doctor would be a decision, a major decision that a sick person would take. Which doctor, where, who should be the doctor, how do I know that the doctor is the right kind of person I would like to visit to? Which hospital should I go? And so many questions that I have to make a decision now. Again, what makes me take those decisions? What are those behind the scene questions that will make me take this decision? One is that, what is the time required? I'll have to spend money on going by travel, or to pay the doctor the consultation fees. Then I may have to buy medicines. I may have to go for a diagnostic test. So there are so many issues that are involved, and therefore the demand of healthcare from me is influenced by those factors. So once I meet the doctor suggests me certain treatment. Now, do I have the money to pay for the medicines, for the tests that are expected of me to be done? If it is not, if I am not insured, it is an out-of-pocket expense, which means I will have to take out money from my own savings and use it for healthcare. So, do I have money at all to spend on healthcare, or do I not have money? In that case, again, the decision will be taken that which kind of hospital one would go to, a private hospital, to an individual physician, or go to a government hospital. So these are again decisions taken based on the economics of that particular situation. Now, health is a commodity. We don't understand health as a commodity normally, but here health is a commodity which is being demanded, and that it is being supplied. So there is a demand for health. So this person who was sick was demanding healthcare. He was demanding doctors, hospitals. He was a pharmacist. He was demanding diagnostic. Support for all that what he was going through. He was demanding the services of a pharmacist who could give him the right kind of medicines which has been prescribed by the doctor, and so on. So we find that there are so many issues that have got economic underpinnings, and it becomes important to look at these subjects from the economic perspective. So a doctor may ask, why did you not come before? You should have come about 2 or 3 days earlier. This would have been easier to treat, but the patient would not be able to tell that I did not have money to come and meet the doctor and get the treatment. So there is this economic side of all kinds of decisions that are taken when we need to look for healthcare. So we need to see what is the affordability that we can, each one of us can have. What are the alternative medicines that are possible? Is it possible that without going to the modern medicine, a person can get cured from the alternative medicines that are available? If it is in practice, whether those can be used? We know in India we have alternative medicine like the homeopathy, the Ayurveda, the Unani, then we have the yoga. Now, will these be taken as an alternative to some of the illnesses that people suffer? In that case, what are these alternatives? What drives people to opt for these alternatives and not go into the modern medicine? So these are issues that a student of economics must analyze from a data perspective and see what reasons drive people to do that. So what is the benefit that persons may derive from these alternative methods of medicine vis-a-vis the modern medicines that are available? So what this whole side of health economics is telling us, that we need to be open to the demand for health and look at the demand for health from different perspective, not just from the medical perspective of the disease, of the cure, of the medicines that is needed, the treatment that is needed. That will not be able to answer the problem of health. Health has to be examined from the economic perspective as well. Now, there is also this issue that there is a lack of knowledge. Now, this patient went to the sick person goes to a doctor. Typically, the whatever the doctor's advice is given, the patient will follow that, and the patient is not sure. The doctor also, in many cases of health condition, may not be sure whether the person would regain health like how he was earlier, or is it going to be worse in course of time? Is it a problem that is of what is the origin of the problem, and so on? So all these can make an individual decision. We can also see for a disease, a doctor may tell that you can come back in 10 days time for a checkup. Now this patient may not go back to the checkup, and then you may ask, why didn't you go back for a checkup? The patient may not have had the resources to travel to that place to get a checkup or to get admitted again. So there are a lot of economic issues in terms of cost and resources that are involved, and of course the benefit that will flow to a person if he or she follows medical care. So the doctor's individual, the person who was sick has no expertise in medicine, no knowledge in medicine, no information about the ailment that he or she has. At the best, it could be some small information that we might have, and it is very costly to get that information. We cannot get that knowledge that a doctor has, because that is their domain of specialization. So in this particular case, since we don't have that knowledge, we don't have that expertise, we don't have that information, all that the patient can do is to depend upon the doctor and build a trust with the doctor, so that this this disease can be cured. So finally, the again that information crisis comes in, because different doctors may prescribe different medicines. They may suggest alternative ways of treatment. One doctor may suggest a surgery while the other may not suggest a surgery. So a confused patient is also a part of this whole system. So what can make the decision for this patient? A large amount economic decisions can make. So whether to go in for detailed treatment with that particular doctor, or go to another doctor, another hospital, and save some money from carrying out certain medical activities, that's also something very important. So information asymmetry is very common problem in the medical healthcare industry, and that is also one thing that we find ourselves taking up insurance, and we will look into these issues of insurance a little later. Information and insurance, both we shall look into later. So all of these stories, we found that there are certain kinds of costs involved. So complicated treatment might range from extensive pharmaceutical and technology products that are available for use now. If that is to be used, then the cost of healthcare will increase. Then we may need to, instead of a general physician, we may now need to meet specialist doctors and specialist equipments, which again makes treatment costlier. A local stay in a hospital, just a visit to a physician, or it is in the state headquarters or in the city, or does this disease require a visit abroad? So any of these possibilities can happen to a patient in terms of the economics of cost of healthcare. Now, we also need to know that when a person is sick, he not only loses money in terms of the money that he has to spend on getting the cure, but he also loses money as an opportunity cost. Because when a person is not going to work on the days he's sick, he or she loses wages of that day. So that is another issue that can happen with healthcare, which we often ignore. What is the cost of attenders who take care of the sick person? Their wages are also affected if a person is a child or somebody who needs special attention to be admitted to the hospital. In all of these cases, not only are we losing money, we spending money to get cured by direct spending, we also have indirect spending of money by losing money in terms of opportunity cost, where an individual is not able to work and earn. So there can be loss of labor, there can be resource constraint, and finally, an individual will have to evaluate all these decisions and then decide what kind of treatment he or she may want to take. Now, so this choice making comes from that. Economics is a subject of making choices. It is a decision making subject. And then why does a person go through all of this? Obviously, the reason is clear. He wants to get well and he wants to move about carrying out his day-to-day work. The question is, can he do it at any cost? Is there a limit to the cost that he can spend on getting back to normal health? So he wants to prevent economic and other laws. He wants to prevent disability. He wants to preserve life. So all of these factors are all related to economics. The medical part of it is how can they taken care of, what medicines and so on. But the economic side of it is this: how can an individual spend that much of resources for this kind of illness? So choices have to be made on monetary factors. Choices have to be made on time related factors. Should you wait for 2 days after a cold or fever to go to the doctor and get tested for COVID? Or should you wait for a week and then go to the doctor for testing of COVID? By the time the situation must have been much worse. So how do we, what kind of factors are the ones that prevent these kind of things from happening? Of course, we know that yeah, if we understand health economics, both for the student of economics and for the students of medicine, we can make a better decision regarding healthcare, especially from the physician's point of view. You will be informed about how these medical decisions that you're taking are not only medical decisions, they are affecting the economic decision making of individuals, and therefore there will be an understanding of the treatment better and more efficient, and more resources will be saved instead of wasting. Now we know, we are very much aware in this world today how medical sector is in so many ways it is wasting a lot of money of individuals to carry on certain many kinds of tests which could have been otherwise avoided. So when we know health economics, we can understand these kind of issues and therefore save resources for the individual, and on the other hand, provide better healthcare to the needy. Of course, treating economics, healthcare with the economic principles has got its own limitation, because many of the things that happen in day-to-day economic concepts may not apply to healthcare in a rational situation. For example, in economics, we say that every individual is a rational person. So we think before doing activities. We logically argue about what kind of things need to be done. But then suppose there is an accident there, so which hospital to take there? For that time there is no rationality. That time it is the need of the hour, and that is what is done. So rationality may not be the only way in which economists can think. There could be spontaneous responses in the case of health. So there are certain kinds of limitations that we find in the healthcare. So, the next session I shall look into the demand for health. And I have just given you an overview of it, because many times it might be that a student of economics can think, what is it that you are going to study? Healthcare and economics, but you can see that there are so many areas that you could specialize in: healthcare, economics, and get into the policy making area or analysis of data that relates to health. And for the students of medicine, it definitely makes good sense to know what are the factors that can influence the course of treatment that they can do and the kind of care that they can provide to the sick. So thank you very much. Do subscribe to this channel and watch the channel for the topics that you may need, because all of them are available there. Thank you very much.